Some early joiners. I like that. Most of the time people are always someone in 15, 20 minutes after this, we get started. So it's nice to see some people that are excited about learning about Social Security. I was telling Megan before this, we do our radio shows in Madison, as you guys know, being clients of ours. And there is many, many times that this is our most questioned topic when we start presenting on this one. So that's why we love having Megan on here to go through some of the more in-depth stuff. And she knows a lot more even than we do. I like to say we know enough to be dangerous on some of this stuff. So. And just so everybody's aware that is here, we will be recording this webinar and we will also post it on our website here. It takes us a little while, a couple days or so a week to get it edited and put up on our website. So you will be able to view this on our website once we're all done here. We do have the chat feature in the Q&A, and there's also a raise hand button down at the end. So we are going to have everyone muted for the time being. But if you have a question, go ahead and enter it in either the Q&A box, that chat, or you can raise your hand, and then I will be funneling the questions to Megan as you bring them up. So we'll try to get everything answered as we go through this. And then at the end, we will probably open it up a little bit for any live questions. We just don't want people, they can get a little tricky with this many attendees and people talking over and not getting questions answered. So we want to make sure everybody has time to get everything answered. We'll give it just a couple more minutes here before we get started. All right. Good. All right. Well, like I said, thank you everybody for joining us. My name is Kyle Kite. For those of you that I haven't met, I'm an advisor here at Klaas Financial. And then we also have Megan Forristall here from the Social Security Administration in our region here. So she's going to be doing most of the presenting today. I'll give a small introduction here in a minute or so. We'll let a couple more people trickle in. And as I said, everyone is muted right now. So if you're trying to talk, we can't hear you. So we're going to use the Q&A function at the bottom of the screen. There's a Q&A, there's a chat, and there's a raise hand. So any of those three buttons, you can either enter questions in the Q&A or the chat or raise your hand. And I'll be monitoring the questions and things as they come through and try to interject them with Megan as she's going along here. Her slides that she goes through is going to answer a vast majority of your questions. So if we haven't got to it yet, there's a good chance that we'll get to it, but please don't be afraid to ask any specific questions. And like I said, those three buttons, the Q&A, the chat, and the raise hand are down at the bottom here. And like I said, we will be recording this, so this will be posted on our website. Like I said, give us a few days to a week, and you'll be able to review this on our website in the future. All right, I think we've got just about everybody that signed up is in here, so we will go ahead and get started. So like I said, my name is Kyle Kite. For those of you that don't know me, I've been with Klaas for just about 7 years. Actually, it's 7 years and a couple days here. I am the Director of Financial Planning is my official title. As you guys know, you've probably seen your email invites. We do this Klaas U, we call it. Klaas University is what it's short for. We do these types of webinars generally once a month here through the spring, and then we kick them off again in the fall. We give you guys the summer off because we know that's when a lot of people, hopefully this year, we'll be back to traveling and visiting family and stuff like that. We cover a variety of topics. So those of you that, obviously most of you work with us as clients, so you know that we do talk about, estate planning and Social Security and taxes and things like that. But with these Klaas U webinars, our goal is to bring in professionals that have even deeper knowledge than what we cover kind of on the surface here. So as you guys know, we like to be the quarterback of your retirement plan, coach and quarterback. So again, we kind of do the overall plan for you and then employ these specialists when we need them. And like I said, most of you are clients of ours, so we appreciate all the trust you've placed in us. We do have Megan Forristall here with us. She is an employee of the Social Security Administration. We've been working with her for probably about the last year and a half now. She does a really, really nice job with all of these presentations and things like that. She's been with the Social Security Administration for about 16 years. And I'm sure she'll give you a more formal introduction as well. So like I said, please, if you have any questions, just enter them at the bottom. Like I said, the Q&A, the chat, or the raise hand, and then we'll probably open it up for live questions towards the end too. So Megan, go ahead.
Yes, thank you so much for having me. And as Kyle mentioned, I've been with the agency for over 16 years, and right now my title is Public Affairs Specialist. I'm been in this position for over 4 years, and I cover a large section of northern and north central Illinois, the majority of the suburbs north of Joliet. So quite a wide range, but I am based actually out of Peru, Illinois, which is where I began my career with the agency. As you can probably tell, I am in my home and I have just given my dog a bride. But if I disappear for a moment, I apologize in advance. If she starts acting up, hopefully she'll stay quiet for the presentation, as we're all kind of getting accustomed to in this virtual world we're in right now. So today we're going to go through an overview primarily of our retirement and programs focused after retirement. At Social Security, we want you to know we are with you throughout life's journey, from the time we issue a Social Security card number as a baby and all the way up, of course, into your retirement party. I'm not going to talk about disability today, but I do want to note as an option, if you are under your full retirement age, that is something you can look into if you go out of work due to a medical condition before your full retirement age. But otherwise, of course, you're going to be looking at the retirement benefits primarily. So the basics of qualifying for a retirement benefit with Social Security, of course, when you're working, and the majority of us pay it into FICA taxes or the Social Security taxes when you're working, you're earning credits toward your future retirement. So for Social Security, you need 40 credits, which many of us can get within 10 years of work, and you must be 62 years of age or older to draw a retirement benefit. So for this year, each $1,470 in earnings gives you 1 credit, and the max you can make is for a year. So like I said, many of us will get these credits within 10 years of work, but as long as you get 40 at some point in your lifetime, you're going to be eligible for a retirement benefit. Of course, most of us are making more than that basic amount we need to just get insured for retirement. And your earnings overall are all going into determining how we calculate your Social Security monthly benefit. So the first thing we do in calculating your benefit is we take your wages and we adjust them for inflation. So you might be surprised to see what the earnings you had in the 1980s actually equal in today's dollars. And once we've done that, we're going to take the monthly average of your 35 highest years of earnings. So sometimes we have some common misconceptions where people are concerned we're looking at your most recent 5 or most recent 10, but we're actually looking at your 35 highest years of earnings. From there, we get an average index monthly earnings and we apply a formula to that. So if you are interested in the details of how we calculate retirement benefits, we do have a publication on our website on how your benefit is figured, where you can even go in and manually adjust all your wages for inflation. If you're not into that kind of math, which is not really my style, then we just provide you the estimate in your My Social Security account, which we'll talk about later. Some other questions we might get when someone contacts Social Security is, when is the best age to start receiving a Social Security benefit? Well, that's going to be different for each individual person, because some people might have the option to continue to work and they're enjoying work and they're going to delay taking their retirement. Others might decide to retire early and take a reduction. So again, 62 is that earliest age you can take a benefit. You can see, for the example on the chart, that this person age 62, they're at $750 a month. And then it goes up every single month that you wait. So 66 in 2 months, you can draw it and it's going to be higher than that 750. And then the next big benchmark though is age 66. That's your full retirement age. Well, this person's full retirement age on the slide. Everyone's full retirement age differs right now depending on the year you were born. And I'm going to show you that in a moment too. Then the next last benchmark is age 70. This is when your Social Security benefits max out. So again, at Social Security, all we can do is provide you with that monthly estimate. You know, you might use your financial planner and some other sources to help you consider when's the best for you. You know, maybe I'm going to try to go out at 62 and start traveling the world, or, you know, my parents watched the grandkids and they retired a little bit early as well. And others, they're going to decide, like I said, to max those benefits. And the situation is going to be different for each person. So here's where you can find your full retirement age. If you are 1954 or under to 1943 to 54 at 66, but as you can see, it's moving up. So generally our retirees that are contacting us to file are in a higher full retirement age at this point. So myself, my full retirement age is 67. So if I do take it at 62, I'm going to be seeing a 30% reduction in my monthly benefit. One huge consideration, and if you're going to take it early generally, is if you're still working, because we do have work restrictions when you are under your full retirement age. So this year in 2021, so all the figures for this presentation are 2021's figures and can go up every year if we have a cost of living. But this year, the earnings limit is $18,960. And that is for the year. If you go over that, we hold $1 for every 2 that you go over it. So let's kind of walk through an example of how this actually works in practicality. So let's say you contacted us this year in January, you're over 62 and you're trying to decide if you're going to take your retirement check, but you're working and making $36,000 this year. So what we do is we subtract the 18,960 because that's the limit. And then we're going to divide the remainder by 2 because we're only holding $1 for every 2 that you go over that. So when I do that, the remainder is $8,520. So the way this works is we hold checks up front in work suspense when you're over that limit. We're going to ask you how much you're making during your application. So let's say you had $1,000 a month for a check. We're actually going to hold 9 benefit checks this year because of what you're making, that $36,000. So we'd hold January through September. And then we would pay you for October, the first month, paid in November, because all Social Security checks run a month behind. So in that situation, when you were talking to us, you might have decided, well, that's not really worth it to me to go ahead and take that benefit early and only get 3 months of checks. If you decided, yeah, I'm going to go ahead and file, that's fine. And what will happen at your full retirement age is that we will recalculate your benefits based on those work suspense months, almost like you would take in your benefit that much later. But that once you take it reduced, it's going to stay reduced even with that work until your full retirement age. Now, we also have, and the limit here is not on this slide, but we have that it's a yearly test. We have something called the monthly test we can do in the year you retire. And so the yearly limit at that $18,960, we just divide that by 12, that's $1,580. So what the monthly test says is it does not matter how much you have made to up to a point in the year, as long as you're going to stay under that monthly limit every single month for the rest of the year. Now, if you go over that limit by $1, we can't use that test anymore. But what that allows for is, say, you're thinking about retirement right now. We're here in May and you're like, well, I'm going to retire and enjoy my summer this year. And it does not matter how much you've made. You could have made $80,000 between January and May. You can start your checks with June as long as you're under that monthly limit. And again, that's $1,580 gross a month for 2021. So that's a good option for mid-year retirees. Then you can see the year you turn your full retirement age, quite a bit higher of an earnings limit at $50,520. So in that scenario where you're making $36,000, you could have started your checks in January and still received all of them. If you should go over it, we only hold $1 for every 3. And then the first day of the month in which you hit your full retirement age, you can work and make as much as you want and still receive all your Social Security checks. There's no limit. You can work and make $1 million. The other thing is, if you do continue to work after drawing a Social Security benefit, every year the computer is going to make sure that they're still using your 35 highest years. So continuing to work might replace a lower earnings year and cause your monthly benefit to increase. Now, in addition to benefits we can pay a retiree, there are oftentimes benefits we can pay other members of a family. So when we're looking at benefits for children, we're looking at any children that are unmarried, under the age of 18, or 18 to 19 and still a full-time student in high school. So when we have someone on benefits already and they're turning 18, they're going to get a letter talking about how their benefits will stop unless they're in high school, and that there's a form that can be completed to continue the benefits up until 19 or graduation, whichever comes first. Then we also have benefits for disabled adult children. So it might be that your child is going to be 40 years old by the time that you file for a retirement benefit. If they've had a disability since prior to age 22, they have not been married or worked substantially on their own record, then they can potentially get that benefit off of your record as a disabled adult child. So these children's benefits, they're for children who have a parent who's on disability, a retirement benefit, or a parent who's passed away. There can be a lot of confusion when we get into talking about spousal benefits. So let's just start with the fact that we have something that came up called deemed filing that's pretty much applying to the majority of our retirees that are considering things at this time. It says that if you're turned 62 January 2nd of 2016 or later, that you always have to take your own benefit before taking anything off a spouse. So for this presentation, I'm going to assume deemed filing, but if you have questions about the other options, we can go through those as well. So what we're going to do, we're going to look, let's say you are considering filing off a spouse. We're going to look at 100% of your own benefit first, regardless of how old you are. If you're looking to take it early, 100% of your own. Then we're going to look at 50% of your spouse's unreduced benefit, regardless of how old they are. If 100% of your own is more than 50% of your spouse's, there is no spousal benefit payable. We're just going to pay you off your own. If it's less, what we're going to do is we're going to pay you what we can off your own, and then the difference off of your spouse's to get to that 50%. And then we're going to reduce it for your age if you are under full retirement age. Now, to get a benefit off your current spouse, your spouse does have to be receiving a benefit from us. These benefits will not reduce the payment of the worker you're drawing off of. So you don't have to worry that you're going to reduce your spouse's benefit. For spousal benefits, you need to be 62 unless you're caring for a child of your spouse, a child of the worker who is younger than 16 or disabled. So one thing to consider, though, is spouses, children, and when we're going to talk about survivors benefits, they all do have that earnings limit that I talked about with you. So if you have a younger spouse, they might be caring for that child, but again, they have that earnings limit. So if they're working full time, they might not be eligible for a check. When you file for your application for benefits, whether you do it online or whether you do it on the phone with someone, they're going to ask you all of these questions to make sure that we capture anyone's benefits, that they're eligible for at the time of filing. Now, divorced spouse benefits, there are some differences with these. So let's say you're thinking about filing off a former spouse. Again, we're going to look at your own, assuming deemed filing, we're going to look at your own first. And then if eligible for a divorced spouse, we're going to make sure you're not currently married to anyone else and that your marriage to that former spouse lasted at least 10 years or longer. You, of course, have to be 62 years of age or older. And then the person you're filing off of, this is the big difference between a current spouse and a divorced spouse benefit. They do not need to be actually filing for a benefit or receiving a benefit yet. They just need to be eligible to receive a benefit, meaning they're at least 62 and they have their 40 credits or they're on disability benefits. Now, anytime we pay a divorced spouse benefit, it does not reduce the benefit of the current spouse on the record, the worker, or any children. It's an independent benefit. Now, as far as survivors benefits, again, there are some differences with these benefits compared to current spouse or divorced spouse off someone who's living. For survivors benefits, the rules for the children entitlement are the same, under 18, still in high school, or disabled before 22. But for surviving spouses or surviving divorced spouses, one of the differences, the benefits will begin as early as age 60 versus 62, or as early as 50 if disabled, or again, any age if caring for that child younger than 16 or disabled. For survivors benefits, another difference is we're looking at up to 100% of the deceased worker's unreduced benefit. At age 60, that's 71.5%. So we do have a lot of situations where a person might not be eligible for a spousal benefit at the time of filing, but if the person that passes away is the higher earner, they then would be eligible for a survivor's benefit when that person passes away. It's important to contact Social Security when a spouse or if you hear a former spouse has passed away, so we can check eligibility for these benefits. It used to be that we got a form from the funeral home, so we kind of had an idea of who to contact, but now this process is electronic. So it's really important to check on your eligibility if you have a spouse that passes away. So again, just a little breakdown for you, the differences between drawing off somebody who's living versus somebody who's passed away. 62 off someone who's living versus 60 off of someone who's passed away. 50% or less if someone's living, 71.5 to 100% off somebody who's passed away. Divorced spouses can qualify for either of these types of benefits. Another thing about survivors benefits, you can get remarried after age 60 and still keep your eligibility to the survivor's benefit. Again, as long as that remarriage happens after age 60. Survivor's benefits are an exception to that deemed filing that I talked about. So you can start on a survivor's benefit, even if your own is higher. You can switch at 62 if that's the point your benefit's higher, or you can continue to wait until age 70 and let your own grow and let your delayed retirements grow. Or you can take retirement as early as 62, then switch to survivors at full retirement age if the benefit is then higher. So there's some different filing options when it comes to survivors benefits. A lesser known type of survivors benefits we have are parents benefits. This would be when a son or daughter was providing at least half financial support to a parent who is 62 years of age or older when they pass away. To be honest, these are very uncommon. I have not taken a claim for them. I think another colleague I present with has taken one in her entire career. So just something to be aware of, but not very common. Then we have our lump sum death payment. You might have seen some commercials refer to this payment. Life insurance commercials like to kind of take a dig at it sometimes. It is only $255. Some people refer to it as a burial payment. Of course, it does not go very far toward funeral expenses today, but it is important to know about because, again, we are not going to know who we might need to pay this to. And it is eligible for a surviving spouse of any age. So even if somebody loses a spouse, unfortunately, very young before they're considering those benefits, it's payable to that spouse or a minor child or disabled child on the record. It is not payable, though, to a divorced spouse or an adult child, like an executor of the estate, something like that. It does have to be paid out within 2 years of when someone passes away. So again, that's another reason to just double check with Social Security on benefits if someone passes away. Okay, we're going to switch gears to talking about Medicare. So just to start off by saying that Social Security, the only thing we do with Medicare is enrollment in Part A and Part B. So for all other things Medicare, you can check out the Medicare.gov website. It's a great resource. So a note just to make sure that .gov is very important. You can see it on all the slides about the Social Security.gov, the Medicare.gov, IRS.gov. Just make sure you're not getting to a .com website or someone that might try to scam you or charge you for information that's free. So for Medicare, for Part A, that's your hospital insurance. If you have your 40 credits or from yourself or through a spouse, that there is no monthly premium for the Part A. There is, of course, co-pays if you should go into the hospital, and that's just for inpatient situations. Your Part B, your medical insurance, the base premium this year is $148.50 a month. So that's for your outpatient visits, certain medical supplies, outpatient procedures, things like that. So the bulk of things you would really be thinking about. And then the Part C and the Part D, those are private companies. So again, we don't handle those at Social Security. You can contact Medicare.gov, or if you need help finding these plans, you can find what we call a SHIP counselor, a state health insurance program counselor. And if you Google Illinois SHIP, they can take you to find your local one. But in general, most local senior centers have SHIP trained counselors who can help you wade through the Medicare Part C and the Part D stuff if you're having trouble figuring it out online. So a Part C, a Medicare Advantage plan, that's when a private company handles all aspects of the Medicare. So you're still in the A and the B. You have to get signed up through Social Security for those. And then you contact the private plan of your choosing to get the Part C. But then all your questions and all the billing goes to that Part C plan. Some people like these Medicare Advantage plans because they include sometimes dental or vision, things that are outside traditional Medicare. And then the Part D, if you have a Part C, many times they're going to have a Part D with them, but you can have it also independently. That's your prescription drugs. Again, there's a wide range of private plans to choose from. So the Medicare.gov website, if you set up a My Medicare account, they have plan finders that can really help you wade through all these private plans, or as I said, those SHIP counselors will do that for you as well. Now, as far as Medicare eligibility, of course, the big time we're thinking about that is age 65, but we do have Medicare for individuals on Social Security disability after 24 months, and some specific policies for individuals with ALS, kidney failure, or environmental health hazard exposure. With age 65, the first opportunity you have to go onto Medicare is your initial enrollment period. This is the 3 months before your 65th birthday, the month of, and the 3 months after. Now, if you are already receiving a monthly check from Social Security, you will be automatically enrolled in the Part A and the Part B. If you need both of those parts, that's great. You can just start using them the first day of the month in which you turn 65. The card comes about 3 to 4 months before your birthday in the mail, though. So open your mail carefully, because it seems like, everyone in the world knows you're turning 65. You're getting all kinds of junk mail. And we do believe that a fair number of people throw theirs away and end up having to request a new one. So just again, open your mail carefully. You can start using that. However, if you are not on Social Security, nothing magical happens at 65 to start your Medicare. You have to do an application if you need it. So just make sure you do your homework before your 65th birthday so that you know if you need to take Medicare or not. If you do the enrollment within the 3 months before your birthday, it will start the first day of the month. But if you wait for the 1 to 3 months after your birthday, it's going to start anywhere between 1 and 3 months after your enrollment month. So just, again, something to be watchful of. Now, you will also in that junk mail be getting all these sorts of things that threaten penalties. So we're going to talk about whether or not a penalty will apply for you in Medicare. So as I mentioned, if you get that card and you're on retirement benefits already, so you get automatically enrolled, you're going to have the Part A in that situation, but you just need to consider if you need the Part B. The situation where you might not need the Part B would be if you are still employed and covering under an active group health plan, or your spouse is still working and covering you under their active group health plan. So current work, we're not talking about retiree plans, anything through the marketplace, veterans coverage, anything like that. This has to be through active employment. We always recommend that you talk to your benefit specialist at work through HR or whatever to double check that you don't need the Medicare. But generally, if you're covered under a group health plan based on active employment, you do not need to take the Medicare, especially the Part B, and you will qualify for that next enrollment period, which is the special enrollment period. So this is anytime after your initial enrollment period that you can get into the Medicare, especially the Part B, without penalty. And that's because you've had that coverage. So most of the time, you're not going to want to pay for both. If you are employed through the group health insurance, Part B is a secondary. So it's not a supplement. It won't cover the gaps. It'll only cover something if your employer group health flat out refuses to cover it and it's coverable under Medicare, which is going to be pretty rare occurrence for most people. So as long as you have that group health insurance, that's just when you're ready for the special enrollment period. There's a couple forms that get filled out, one by you and one by you or your spouse's employer, that gets you into that Medicare without penalty. Now that last enrollment period, that's where you find the penalties at. So this would be if you just kind of disregard everything we're talking about today. You say, I don't want Medicare at 65, the Part B anyway, because it costs money and I never get sick. And then several years down the road, something happens and now you need the Part B. Well, unfortunately, for the Medicare, the only time you can get in then is January through March of every year. The coverage does not begin until July of that year. And there is a 10% penalty onto your monthly premium for every year you didn't take it. So if it's 7 years later, it's going to be a 70% penalty. And that penalty remains for the rest of your lifetime. So that's just why it is important to do your homework coming up on 65. Now, as I mentioned, the standard premium is $148.50, but some individuals are going to be subject to a higher additional monthly premium on their Part B, as well as onto their Part D. So you can look at this chart to see if this situation might apply to you. This is called IRMA, Income Related Monthly Adjustment. We have information too on our website about it. If this situation applies to you, you will get a letter in the mail explaining why it applies to you. We're actually used for this, your modify adjust gross income from 2 years prior tax. So for this year, we're using 2019. If you fall into one of these higher categories in 2019, you can find that additional premiums you're going to be facing in the chart. So your letter will also talk about some situations where we might be able to use a different premium year. So let's say that you have had these higher monthly modify adjust gross income in the previous years, but this year you stopped work. Pretty common situation, of course, at retirement. If that's going to cause your modify adjust gross income to drop you down a category, you can do a life-changing event form and submit it along with proof of your work stoppage. And we can potentially use even an estimate for this year's modify adjust gross income to reduce or eliminate that income-related monthly adjustment. Other individuals are going to consistently have these additional premiums. Just kind of depends on your economic situation. And then, as I mentioned, that Medicare.gov website is where you go for all things outside of enrollment in Part A and Part B. And you can create a personalized account as well to find all of your billing information, all that sort of things. As far as applying for Medicare, that can be done right on the Social Security website. Very easy to do. If you're doing Medicare only, it usually is 10 minutes or less. If you have gotten on the Part A and refused the Part B for your special enrollment period, there's just a couple forms that we need. And I meant to update this slide. We have a couple new ways to get this special enrollment period done. We do need these forms no matter what, the 40B and the L564, or if you're for some reason can't get your employer to complete the 564, there's a couple of alternatives we can use for proof of employment. And then you can mail them, you can fax them, or you can submit them online. So a lot of options to turn them in. There's that My Medicare account that I mentioned where you can check on your different health and prescription drug information, your deductible information, prescription costs, those things. Now, as far as applying for all the benefits we talked about today, except survivor's benefits, you can file online, and that's generally the easiest way to take care of it. If you are needing to file for survivors or otherwise unable to file online, you can call our 1-800 number to schedule an appointment. Sometimes they might even refer you to our claims taking unit to take the application right away. If you're wanting to deal directly with your local field office, and I'm going to say that this slide, I don't like that link on there. As if you go to ssa.gov/locator, that's easier to type. This will take you to the spot where you can put in your zip code. And as you can see on the note, we have suspended primarily our face-to-face service right now. That has not adapted yet. So if you need to deal with your local field office, this is the easiest way to deal with them. Putting in your zip code, finding their local phone number, you'll still be able to talk to somebody at the local office. We have certain critical services that we're providing in person, but again, those are very limited and by appointment only. In addition to phone, of course, we have a fax option and we have online services. This is our socialsecurity.gov website. Now these panels will look different. The main panel will look different depending on what the hot topic is. Like I think right the moment or within this last week, the big panel is baby names because that's kind of a popular thing that goes on with us every year. It's actually the highest day of traffic to our website all year. Everyone loves those baby names, but depending on the time of year, you'll be able to find the most relevant thing right there. But the other panels remain relatively the same as far as being able to click on retirement, disability, Medicare to get enrolled pretty easily. There is a banner to click on if you're receiving scam calls where you can report them. And you can see that coronavirus COVID-19 update. If you were to click on that, you can subscribe to alerts whenever we do change anything about our services related to the pandemic. We will post updates there. I also really like the frequently asked questions section that's right on the top. So if you have something that you think about after we're done today, check out that section. It might be available to you there. And then our My Social Security account is featured as well. This is, again, signing up for email alerts if you're interested in for that COVID-19 update page. Can be handy. You just get a notification that we've posted something new in the page. Then we have a lot of great calculators on our socialsecurity.gov website. So we have our retirement estimator, which I would say is one of the most popular ones and has a lot of great options. But we also have an earning test calculator to help you wade through that. If you have a non-covered pension, maybe you have your 40 credits, but you are in the teacher's retirement system in Illinois, we have the windfall elimination provision or WEP calculator that would be handy for you. So a lot of great options there. The retirement estimator, as I mentioned, is really neat though. They now have one behind the My Social Security portal, which makes it even more user-friendly. You can use this as long as you're not on benefits or waiting for a decision. And as long as you don't have a non-covered pension, because it won't calculate things correctly then. So we recommend that everyone over age 18 creates a My Social Security account. Really great features we're going to talk about and just important thing to do. And it's getting even easier to create one of these accounts. We have some new options for signing in and creating one. So if you go to socialsecurity.gov My Account to sign in or create an account, one of the things, the options are security questions. Like there are something like you had a auto loan from this year from this company. The answer might be none of the above. But what we've recently added is a feature where you can either take a picture or type in the information from your driver's license and get through the security that way as well. So it's even more user-friendly than having to go to those security questions. And once you're through whichever way you choose, you're going to get a username and password you're setting up. and then how you want to receive a security code each time you access the account. You can do it by text or email. Personally, I think as long as you don't have to pay for text, that just works the easiest for me. It pops right up on my phone. And again, you put that in every time you log in. If you're having difficulty creating an account, it could be that you have blocked your electronic access with us, or placed a credit freeze on your account, or moved or changed your name recently. If you've done the credit freeze, what you could do is take it off for one day, go in the next day to create your account, and then you'd be able to put it back on. To be honest, I don't have any word of whether when you do the driver's license option, if it matters if you have a credit freeze or not. So I'm hoping that that circumvents that, but I don't know 100%. So why you might get a My Social Security account? Well, in the state of Illinois, what I think is really great, and in Illinois, if you have a driver's license or state ID, in Wisconsin, if you are tuning in from there, by chance, you do have to have a driver's license. The state D is not an option, but you can replace your Social Security card. So this is especially helpful right now with that limited in-person service. You don't have to mail in a driver's license or passport, anything like that. You can do it right online. And then when you're planning for retirement, you can get all those important estimates that help you plan your own possible spouse's benefits, survivor's benefits that your family would be entitled to if something happens to you. And check your earnings record. So we used to send out the forms every year. They were white with green ink. And I often would ask somebody in our interview, well, did you review your earnings? And they all look correct. Well, I didn't really look at that. So that was the main point of sending those out, to help you plan, but also to make sure our records are correct, because it is much easier to correct earnings that are missing from 3 years ago, and rather than earnings missing from 20 years ago, you discover when you file. So once a year, you'll just get a reminder to log in, make sure everything looks good. Then once you're on benefits, a lot more you can do. You can even opt out for mail notices and just have them online. You can report wages upon disability, check your benefit, and you can change your address, phone number, direct deposit. You can replace your Medicare card. If it's the day of your Medicare or your doctor's appointment, you can get proof of that Medicare. During tax season, you can replace a 1099. And then even if you're not on benefits yet, you might have helped a family member or friend who has told you, I need my award letter, or I need proof of income. There's a lot of different language people use. We call that a benefit verification. Those can be printed right from your My Social Security account. And a lot of different agencies, sometimes loans for banks, require that type of proof of income. So it's really easy to get from there. And then just a note on those phone scams. I touched on though that we have a link to report those. This is still a big problem. I was actually volunteering at a vaccine clinic Saturday, and a woman came into the health department talking about needing to replace her Medicare card, because basically what I figured out is she got a scam call and they were telling her she needed something, but they were really trying to get information from her. So just know that we will never threaten you. We'll never say we're going to suspend your Social Security number, demand immediate payment, especially like by cash, gift cards, prepaid debit cards. If you owe us money, you'll get a very official letter with very official ways to pay it, by credit card or check. So just know that we are not going to do that. And if you do get a scam call, please hang up. Do not give any personal information. And you can report the scam if you're able to that OIG website. And if you can help us share the word on these, because it is, like I said, continuing to be a problem, especially for our more vulnerable populations. And one way you can keep up on us is to follow us on social media. We have Facebook, Twitter, Instagram, LinkedIn, and a YouTube channel. I'm available for any questions.
All right, perfect. Thank you very much, Megan. So one question that we get sometimes as planners is for people that have decided to turn on Social Security but are not receiving or they decided to turn on Medicare. So they've turned 65, they're going to take advantage of Medicare A and B, but they don't have their Social Security turned on yet. So they're not automatically deducting that from their Social Security check. How do they go about that? Paying for it and things like that.
Paying for it? So Medicare will bill quarterly when someone is not receiving a Social Security check yet. Now, if you start in the middle of a quarter, you might end up getting your first bill for 4 or 5 months. So I usually tell people, as soon as you know that Medicare has started, to budget out that premium so you're ready for that bill. Now, they also have an option that you have to set up through Medicare directly, but there is an option to have Medicare take it out of your bank account every month as well. And then once you start receiving Social Security, then it'll switch over to automatically coming off your check.
Perfect. Okay, so we will open it up for any questions right now, guys. I appreciate everybody for joining us. Like I said, there is a question and answer box down at the bottom of your screen. So if you don't see it, your mouse is probably just sitting still. Go ahead and move your mouse and you'll see some buttons pop up down at the end. So there is, like I said, the question and answer box, or there is a raise hand. And then I will also turn off everyone's mute. So if they want to just ask a live question, we can do that. We've got a hand raise here. 1 second. All right. Gary, you should be good to ask your question once you unmute yourself, sir.
Okay, Kyle, can you hear me?
Yep, we can hear you.
All right. I have a question, and it's in regards, my wife is getting ready to retire. She started the process of applying for Social Security. And then after some discussions with Kyle, we've decided that she should wait for her application for Social Security, but the process had already got started. What do we need to do to stop it, I guess?
If the application has been submitted already, whether she did it online or she did it through an interview, she'll want to contact the local office, because there will be a withdrawal form that we need signed. So I think you can find that withdrawal form online. It's a 521. But once it's submitted, it's signed for or a tested application, we do have to have something in writing saying that the person does not want it anymore.
Okay, I think she is trying to talk to them. We did get something in the mail today, but I didn't open it up prior to this meeting.
Yeah, it might be that form then, hopefully, and she'll just want to get that back.
What'd you say the form number was? I'm sorry for interrupting.
521.
Okay.
If she should end up getting any payments during this withdrawal process, those will just have to be returned to us to finish processing the withdrawal.
Okay.
But she can withdraw within 12 months of filing. So it's a one-time offer within 12 months of filing. So she's still good on time to get everything done.
Okay, thank you.
You're welcome.
All right. Anyone else want to raise a hand if you have a question? Or like I said, we have the Q&A buttons down at the bottom as well. Nothing? Well, that means you did a good job, Megan. Between what you told them and what we've talked about them, they don't have too many questions, which is good. Obviously, like Megan said, guys, and as we talk about with our clients, it is a truly personal decision. Everybody's situation is different as far as when you should turn it on, and if you do, spousal benefits and all that kind of stuff. We truly got to go through your whole situation to kind of figure out exactly what makes the most sense for you guys, because there are a lot of ins and outs with Social Security. And as you've seen, Megan just touched on a few of the most common ones, but there's a lot of different ways that you can qualify for benefits and things like that. So, okay. Anybody else have any questions before we wrap this up? All right. Don't see anything. Well, thank you everybody for joining us again. We appreciate having Megan here. Like I said, this is recorded, so we will post this video on our website. Like I said, give us a few days to a week, and it should be up on our website. You'll be able to review this, and kind of that'll obviously Megan's slides and stuff will be in there as well, so you'll be able to redo those as well if you need to. And like I said, we try to do these at least once a month here for the first couple months out of the year, and then we'll turn these back on in the fall. I don't know that we have anything scheduled in the summer, but keep an eye on your email, and we will let you guys know when our next Klaas U webinar comes along. So thanks again for joining us, and thank you, Megan.
All right, thanks for having me.
Bye-bye.
Bye.